Well, healthcare is a sixth of the economy, and it's so important to each one of us, so it's important we get this right. I believe the Affordable Care Act was a mistake. The federal government had already been involved for decades in wreaking havoc on the incentives faced by businesses and consumers, individuals and patients, and increasing the costs through regulation of the supply of healthcare professionals and pushing more spending through the health insurance system. What we need is deregulation. On the supply side, we should increase the number of healthcare professionals dramatically. I've talked about this in my governor's race last year and my Senate race this year. Let's increase the number of doctors. From 1975 to the early 2000s, a 30-year period, we didn't increase the number of MDs granted in the entire United States. As population increased and healthcare demands increased, MDs granted were flat. There's very little innovation in medical education in terms of producing doctors at lower cost. And one of the reasons is the way we pay for it, which is heavily government funded and regulated, and the accreditation process. When it comes to the licensing system, we require doctors to go through a specific accredited school. We require that any doctor coming from another state gets relicensed. We limit the number of doctors coming from other countries. Not only that, look at what we do to nurse practitioners and physician assistants. We limit what they can do and what they can provide. What we should do is pass increased scope of authority in independent practice statutes to increase the number of nurses and physician assistants and increase the services that they can provide. We should also increase the number of immigrants who can provide healthcare services as nurses or doctors. And we should make sure that the marketplace for healthcare services is open and competitive. We have something called the Certificate of Public Need in Virginia. If my sister, who's a radiologist, wanted to open up a new business, she would essentially have to lobby the Board of Health and get the permission of her competitors to enter the marketplace. The only thing that I want to know that there's a public need for a service is that there's an entrepreneur who's willing to put her capital at risk to open a business and provide a service. Just by increasing the number of healthcare professionals, that's going to enable us to reduce healthcare costs and get a clinic or a healthcare provider in every community in the state and in the country. We should also fix the regulations that create perverse incentives for overspending on healthcare through increased demand. We push more healthcare spending than is appropriate through the insurance system. We do this in a variety of ways. One is the tax-preferred status of employer-based health insurance. If you're paying for health insurance through pre-tax dollars, you're going to try and push as much spending through the insurance system. And when there's an insurance payer, any third-party payer, there's not going to be the kind of incentives to conserve and economize on health resources. By fixing the incentives and creating a more open and competitive marketplace, fixing both the supply and the demand in the healthcare sector, we can provide affordable healthcare for every single American, clinics and healthcare professionals in every community. And we can further drive technological and business model innovation in the healthcare sector, which is what's going to further reduce and even revolutionize the way we deliver healthcare to citizens.